And here we go. Okay, hi everybody. Aaron Green from COVID Talks. Today I'm going to be speaking with Alex Siegenfeld, who's been working with New England Complex Systems Institute on several papers that have been published recently. Alex is a physics PhD student at MIT. He's a researcher with the New England Complex Systems Institute and also working with MIT Media Lab. Alex, pleasure to have you.
Thank you. Pleasure to be here.
Okay, Alex. So what I wanted to do today was go through your paper, which is published on Archive. The paper is entitled Eliminating COVID-19, the Impact of Travel and Timing. This was published initially on the NEXI website in March and subsequently on Archive in the beginning of April. I personally love this paper, and it's been the foundation of my work, working with the travel restrictions guidelines for communities, and wanted to have a chat with you about your firsthand experience from the paper and hearing it from the source. So I guess if we start here, what was your impetus for writing this paper?
Yeah, it started back in very early March when I guess the disease was already spreading in the US for a while, but at the time it wasn't exactly clear the extent of the spread. And I was essentially, I had seen NEXI's recommendations, or had heard from UNIR NEXI's recommendations regarding a sort of color-coded zone for pandemic containment, where you have green zones in which can be mostly open, maybe with some precautionary measures, but then you also have like yellow, orange, and red zones in which stricter measures are needed to contain the virus.
Mm-hmm.
And I was wondering, like, okay, what would be the best way to just model this mathematically? And my goal wasn't to create anything super complicated or sophisticated, but rather just to, with the math, capture the key ideas that were necessary. The details of the disease, we don't even know fully, not even yet at this point. And there's just so much inherent unpredictability with the pandemic. So to me, it was most important to capture the general features rather than like worrying about the details.
Yeah, so if I remember back in March, we had put that up on the website with the color codes, but it wasn't really formalized. This is kind of a way of going towards a formalization of the color coding. Is that right?
Yeah, that's a good way to think about it.
Okay. Yeah, so I think if probably the best thing to do here in going through this paper is to just go figure by figure and help to explain to the listeners what each figure means and how it's relevant to the overall message that you're getting across in the paper.
Cool, sounds good.
So if we start with figure 1, we have this chart of the mean size of future regional outbreaks against transmission between regions, and we can see it's delineating two different phases. One is a stable phase and an unstable phase. Can you talk about a bit about what that means?
Yeah, absolutely. So a lot of the idea of the color coding actually came from NEXI's experience with the Ebola outbreak in 2014. And when the Ebola outbreak was spreading throughout Africa, mainly West Africa, a lot of epidemiologists were saying that it couldn't be stopped and that it was just going to sort of go through until like burnout or herd immunity. And that would have, of course, resulted in a huge number of deaths. But instead what happened was that organizations realized that they could sort of beat this virus community by community. So, and the first thing to do was to reduce travel between communities. And they did that, sometimes just by like cutting down trees and having like the tree trunks lay in the middle of roads. And then second, they need an approach where within each community, they are able to contain the virus, to get the reproductive number of the virus less than 1 within that given community.
Mm-hmm.
And the point is that something above just contact tracing was needed. When essentially, if there's a few number of cases, you can use contact tracing, but once the disease is already spreading throughout the community, a term that's known to epidemiologists as community transmission or community spread, it's really hard for contact tracing to work because there's like a lot of spread through unknown contacts, et cetera. So instead you need like to treat the entire community as infected, and you need to be able to contain the outbreak within that community. And, as we know, what happened for Ebola in Africa is we were able to defeat it. We were able to eliminate the outbreak. And essentially this happened region by region. And the fact that there were travel restrictions between regions meant that even if one region was still having a lot of spread while another region was cleared of the Ebola virus, then it was not as likely that the Ebola would be transmitted from an infected to a uninfected community. Now, of course, nothing's airtight, so it's always possible that a community that eliminated Ebola could be infected again. So the real question is, can you eliminate it fast enough within communities such that even if some communities become reinfected, on average over time, you're able to drive the virus to extinction? So this is sort of mathematically doing the same thing for COVID-19, although it really applies to any disease. And getting to this figure, the unstable phase is when the disease is spreading from community to community. So when the number of regions that have like Ebola or COVID-19 is increasing over time. Mm-hmm. And in the stable phase over here, it's the opposite. The number of regions that are infected with the virus are decreasing over time. And if you're in the stable phase and you stay in the stable phase for long enough, then the virus will be eliminated. And the stable phase also has the property that, let's say you had like a collection of regions, like let's say the United States, we consider it as a collection of regions, and we were in the stable phase and we got rid of the virus. And then the virus was re-imported from, somewhere external from the US into the US. If we're in the stable phase, then because elimination is stable, even though there was an additional importation of the virus, the number of infected regions within the US will still decay back to 0. Mm-hmm. So for instance, let's say someone like, flies into New York City. And so New York City has a small outbreak and has to control it again. But, the rest of the country might not have to lock down. Mm-hmm. Or maybe New York gets infected and a couple other places get infected. But then because we're in the stable regime and regions are ready to act quickly enough, essentially over time, the number of regions that are infected declines back down to 0.
So it's kind of like in that stable region, it's a hazardous environment to the virus. When it lands there, the tendency is for it to go to 0 rather than to explode exponentially.
That's right.
And that can be due to the control measures that are put in place, some cultural norms, things that people have done perhaps to change their previous behavior. Let's say they were in an expanding environment, an unstable phase area. They've changed their behavior to become a stable phase, and then the virus has a hard time replicating.
That's right. It's very analogous to the individual reproductive number. When R is greater than 1 within a community, the virus can spread, and when R is less than 1 within a community, the virus doesn't spread within the community. And this is sort of taking it a level up to looking at spread between regions. And it's essentially like, will the virus spread from region to region, or is the virus gonna, even if it initially infects a few regions, is it not going to be able to create a self-sustaining spread between different regions?
Okay, that's great. So then let's go on to the next figure here, figure 2, where we have the number of active infections in a region as a function of time here.
So, yeah. So figure 2 is sort of a idealized version of like what happens within a given region. Obviously, no region is going to experience perfect exponential growth followed by perfect exponential decline. But the essential idea here is that if you're a region and let's say you're infected with the virus, and maybe at first you're able to contain the virus through contact tracing. But if the virus sort of leaks out, if you start getting exponential growth, then as a region it makes sense to lock down as soon as possible, because to at the very least impose measures that cause the number of infections to exponentially decay rather than exponentially grow. But especially at first, the lockdown is safest.
Mm-hmm.
And it's better to do that sooner rather than later, because the sooner you do it, the sooner you'll get back down to the virus being contained.
Mm-hmm.
And yeah, the exact shape of the curve doesn't matter for the analysis. The point is really that we just want to model the fact that, if a region is caught off guard, it might experience some exponential growth. But then once it realizes that it's infected, and if politicians and community members take action quick enough, you can change that exponential growth to exponential decline. And
Mm-hmm.
certainly this is very possible. We've seen it in hundreds of different regions and countries around the world. They've managed to turn exponential growth into exponential decline. So we know that it can be done, and the assumption is that individual regions will take action in order to do that. Or if they don't take action to do that, or the longer they wait to take action, that's going to be one of the determinants of whether you're in the stable or unstable phase. To be in the stable phase, regions don't have to be like constantly locked down or anything. If they're clear of the virus, they can go back to normal, but
Mm-hmm.
they do have to be vigilant. They have to be ready to act quickly.
Yeah, I think that's an important note here is the longer you wait to take control measures, the the longer it takes to clear the virus after you've implemented the measures.
Yeah, and in fact, assuming an exponential growth followed by exponential decline, if you hold the rate of exponential growth and the rate of exponential decline constant, then it's actually more or less proportional. So that such that the amount of time that you have to impose the social distancing measures is proportional to the amount of time you waited.
Mm-hmm.
And the exact constant of proportionality depends on how good your measures are, how quickly you can get the exponential decline to occur.
Sure. Okay, let's move on to the next figure here. And here we have the number of confirmed cases versus the date of onset of symptoms for China and Italy.
Yeah. So a lot of data is just based on the date of diagnosis. They'll test people and then they'll release. We found this many coronavirus cases today, and that gives you a rough idea of what's going on. But it depends a lot on how much you're testing at various points in time. So for instance, especially very early in the pandemic, and you can see these dates go back to like January and February, if you're gradually increasing the number of tests, then you might catch different cases at different stages in their development within the individual.
Mm-hmm.
So instead, at least for China and Italy, they not only recorded the cases, but also asked the people, when did you first get symptoms? And, this isn't a perfect measure because people can misremember when they got symptoms, but this sort of at least controls for the fact that, people might be tested at different dates. So if the date of onset of symptoms presumably is not affected by when you're actually tested. And so this data tends to be more smooth than smoother than the normal case count by date of diagnosis, because it doesn't depend on like how likely you were to get a test that day or how available tests were at a certain point in time. So that's why we wanted to use date of onset of symptoms. And, at least in China, from January 12th all the way up to January 23rd, when they imposed the lockdown, you have a remarkable fit of exponential growth. It's almost just like, it's very close to exponential growth, not very noisy. And presumably that's because before January 23rd, very little was being done in China. So there wasn't like a gradual increase in like social distancing. It was relatively sudden, where you had people, going about their lives, and all of a sudden January 23rd lockdown. So you get this exponential growth. And then you can see that there's, some period, there's some lag, because even once you impose the lockdown, there might be other people who are already infected, but who haven't shown symptoms yet, et cetera, et cetera. And then after that, you start to get exponential decay. And unfortunately, the data source that had by onset of symptoms only went up to like February 5th for China. And in Italy, you see the same thing. There's exponential growth early on. It seems that at a certain point, some measure, and in fact, looking at the timeline, the government sort of implemented some measures towards the end of February, and people were getting worried, and it seems like the rate of growth slows down a bit. But it's not until March 9 when Italy imposes a lockdown that I think it was a nationwide lockdown, or that like you actually start to get an exponential decrease in the number of cases. And the exponential decrease is slower than that of China, probably because Italy's lockdown was not as intense as China's lockdown.
Mm.
Of course, data from China does have to be taken with a grain of salt, because their government is not necessarily 100% trustworthy in terms of the numbers they release. But we get this picture basically that validates figure 2, where you start with exponential decrease. You start with exponential increase, and then you impose measures, and then you get a exponential decrease.
Okay. Yeah, so let's tie it all together here with the last figure in the paper, which is figure 4. And that's talking about the basically how the number of regions scales with the time delay in social distancing measures.
Right. So what it's really trying to measure is figure 4 sort of complements figure 1, in that we're trying to determine whether or not we're in the stable or the unstable regime. And so if this region to region reproductive number, R star, is less than 1, you're in the stable regime, which means that it's not favorable for the virus to spread between regions. While if R star is greater than 1, then you're in the unstable regime. And so this graph is trying to determine whether you're in the stable regime, i.e. R star is greater than 1, or the unstable regime. And it's trying to do that based on how quickly communities take action, how quickly regions take action. And then it's also showing different graphs for the effect of travel restrictions. Mm-hmm. And you see that, some of the parameters had to be estimated. So it's not like a definitive, it's not an exact guide. It's just trying to give a rough idea of like how quickly do you have to act. So you see the blue line without any travel reduction. And this sort of assumes that regions are more or less the size where to get between regions, you'd probably take a plane. But without travel restrictions or reductions, these people can, travel less even if they're still allowed to. You see that you have to act pretty quickly, like approximately within 7 days, in order to beat the virus. And with travel reductions, and the difference between the orange and the green line is whether you keep, the orange line means you reduce travel once you're already infected. So if you're infected, if the region has a lot of spread, you don't let people leave, or you reduce maybe you can let people leave for certain reasons, but you try to reduce the amount of people who are leaving that region and therefore spreading the virus elsewhere. While the green one indicates a 4-fold reduction in all travel, regardless of whether you're coming from a region that's infected or uninfected. And you can see that travel restrictions buy you a lot of time. And that's, they give you a lot more room in terms of how long you have until you have to until you have to impose measures that cause an exponential decrease rather than increase in the number of infections. And so one of the things that this is that, like, for a given responsiveness of a community, let's say a community can only take action at a certain rate or so fast, whether or not there's travel restrictions between regions could be the difference between the virus hopping from region to region and spreading to a lot of regions versus the virus essentially not being able to do that, versus elimination being stable and the number of regions that are infected dying out to zero. So essentially the two messages that this graph is trying to say is that if a region is experiencing exponential increase, it needs to act immediately. The sooner it acts, the better. And second, that travel restrictions really help a lot. And so those are really the two big policy recommendations. If a region is exponential decrease, that's great. But if it has exponential increase, then it really needs to act quickly. And overall, you just make a collection of regions more stable if you can reduce travel in ways that are feasible.
Yeah, and I think those 2 points of the paper, so social distancing, I like to call it physical distancing. Here we are socializing right now, but physical distancing and travel restrictions can make a huge difference, and it's better late than never. The earlier you can do it, the better, but it's better late than never. And going forward here, if we talk about how this work has been incorporated into the end coronavirus work, we have this graphic, which is fairly famous now. It's been viewed millions of times, called Crush the Curve, where we show through your work here that the implementation of travel restrictions and lockdowns can not just flatten the curve, but crush the curve. So, Alex, it's been a pleasure speaking with you, and looking forward to chatting again, okay?
Yes, thank you.